Namaskar and a very good evening all. Myself, Monica, and it is such a pleasure welcoming you all on behalf of YA to yet another webinar this evening. September is the Nutrition Month as well as PCOD Awareness Month, which brings us to the topic of today's session, wherein we'll be talking about the various aspects of PCOD, which we all know about it. And I mean, we have experienced it. So many of us have experienced it and face it. So we have a very esteemed panel of guests here who are going to take us through this session this evening. The incredible response that you have been giving to these sessions is what I wish to thank each one of you out there. The continued encouragement and support from the school fraternity, that includes the principals, teachers, students, and parents, is the driving force behind all the brainstorming that brings us to such insightful sessions. And for those who are joining us for the first time, let me tell you that this initiative is created by Team YA. YA, which is an acronym for Young and Enthusiastic Adults Hub, is an edutainment program which is dedicated to the school-going young adults. It has been designed to give the school children space to understand, think, create, and engage in different activities and things which are, apart from the routine curriculum, the routine, their academics, and the life that revolves around them. So I request you all to stay tuned for our upcoming activities on our Facebook and Instagram pages named YA, that spells Y-E-A-H, with an exclamatory mark at the end. Coming to today's session, we have, as I told you, we have very esteemed and very experienced professionals with us as our expert panelists. We have Dr. Medhavi Gautam, Dr. Manisha Gaur, and Dr. Shikha Gupta as our guests. To introduce Dr. Medhavi, well, Dr. Medhavi is known to is a known person to the YA family, wherein a lot of participants who have been a part of her webinar earlier, which she conducted at YA, wherein we spoke about the new how to boost your immunity during pandemic times. We all know her. So Dr. Medhavi is a consultant dietitian, nutritionist, health and wellness expert, and is the director of Medhavi's NutriFit Jaipur. So may I request Shilpa to introduce and welcome our guests on board. Shilpa, can you hear me?
Thank you, Monica. A very warm welcome from my side too, to all of you, all the attendees here. Thank you for your everlasting support. And as Monica just said, for today's session, we've got these prominent professionals with us. Dr. Medhavi has been introduced by Monica. Definitely, she's not a new face with us. She's a family, as she said, and Monica just introduced her. That's the biggest introduction for her from my side. So I would like to welcome Dr. Manisha Gaur and Dr. Shikha Gupta. Thank you so much for being on board. Honored to introduce Dr. Manisha Gaur is a clinical psychologist, a counselor, and a relationship expert. She's a co-founder, co-director with Gaur Mental Health Clinic, which is a de-addictive and heart-to-heart counseling center in Ajmer. With the experience of over 1.5 decades, and especially working for children in the field of dyslexia, autism, mental retardedness, suicidal tendencies, etc., all these things, she's done a wonderful job. And she's been working with various government and non-government organizations, training teachers and B.Ed students to recognize dyslexic children. She's trained over 4,000 teachers and B.Ed students in past 1 year, which is a huge number. Great to hear that, Dr. Gaur. Apart from that, she's also working with various organizations working for poor and needy people in the field of mental health. She's also a founder member of a group called Positive Thinking and Happy Us, which works towards mental health issues and thinking positive. We're happy to say that Dr. Gaur is also establishing her own NGO, which will be working free of cost for poor and needy people, whether children or senior citizens. Wish you a very good luck, Dr. Gaur, for this. And we are so glad to have you on board. There's a lot to talk about you, about the kind of awards that you have received and kind of recognition that you have. It's tremendous. We are so honored to have you, Dr. Gaur. About Dr. Shikha Gupta. Shikha Gupta has got experience of over 22 years in this field. She's been a consultant reproductive medicine for a very long time with various hospitals in the city like Vasundhara IVF Center, SK Soni Hospital, Manipal, Ankur, and now she's working with Nishant Fertility Center, Jaipur. She's also been a senior resident with one of the very famous private hospitals of the city. She's been a consultant obstetrics and gynecologist with Saket Hospital for over 12 years. She did her MBBS from RNT University, Udaipur. We are so glad to have you here, Dr. Shikha Gupta, talking about these very sensitive issues which today's girls, teenagers, adolescents, they face, and how you can guide all these girls and their mothers and all of us. It's an honor to have you all. Over to you, Dr. Shikha Gupta.
Thank you for nice words. Good evening all. So today we will learn something about PCOS, that is polycystic ovarian syndrome. So polycystic ovarian syndrome is the most common endocrinal disorder affecting the reproductive age group of female, and it consists of set of symptoms which are mainly related with anovulation and hyperandrogenism. As it is a hormonal disorder, so first we will learn what happens in the normal menstrual cycle in females. So in normal menstrual cycle, there are two phases. One is proliferative phase, that is day 1 to day 14, where your follicle grows under the effect of estrogen and attains the size of maturity. Then around 11 to day 14, they ovulates. That means the oocyte releases from the mature follicles, and then it turns into the corpus luteum and start releasing progesterone. So the later half of your menstrual cycle is secretory phase or progesterogenic phase. This happens normally in the menstrual cycle. Now what happens in PCOS? In PCOS, there is insulin resistance in the body. So now what is insulin? So insulin is a hormone that is secreted from the pancreas, and it regulates the sugar uptake in your body cells. As your body cells are resistant for the effect of insulin, what happens that pancreas starts releasing more insulin in the circulation, and that lead to hyperinsulinemia. So this hyperinsulinemia in turn causes increased testosterone level in the female body. Now, small amount of testosterone is present in female body normally, but in PCOS, the level increases. And this increased level of testosterone causes derangement in the ovarian function, and the follicular growth has arrested at the early state, and it is not attaining the maturity level. So ovulation will not occur, and so the main symptoms you get in PCOS are mainly related with anovulation and hyperandrogenism. So what are the symptoms you get in the PCOS? So the most important symptom is the cyclical irregularity, and the cyclical irregularity may present either in oligomenorrhea, that is you are getting less than normal period, or polymenorrhea, that means you are getting more than normal periods. Then sometimes you are not getting your period at all, that is amenorrhea. Then due to hyperandrogenism, that is increased level of testosterone, the girl may present with hirsutism and acne. Now hirsutism means the increased facial hair growth or the male pattern of hair growth on your legs or arms. Then due to insulin resistance and glucose intolerance, obesity also prevails, and it is a central type of obesity. So these are the main common symptoms you get in PCOS. Sometimes cutaneous patches, you get some cutaneous patches, that is also known as acanthosis nigricans. Now, as you are in the adolescent state, that is the age of around 11 to 19 years, or you can say your teenage. So this is the age when you are getting your menarche. Menarche means the initiation of your menstrual cycle, which occurs normally at the age of 11 to 13 years. And prior to menarche, the initiation of breast development occurs, which occurs usually at the age of 10 to 12 years. So this is the time when you are undergoing the pubertal transition. So the normally, the girl is not PCO, but cyclical irregularity persists for up to 1 to 2 years after menarche. So it is very tricky to diagnose PCOS in this age. So there are certain guidelines are given which help us to diagnose the patient correctly, and also this is for your information that when you should consult the doctor. Like for 1 year of the menarche, if your cycles are irregular, need not to worry. But from 1 to 2 years, if you are not getting your cycle more than 90 days, that is 3 months, then you should consult your doctor. Then from 2 to 3 years, if you are not getting your cycles more than 45 days, means 1.5 months, or you are getting your cycles less than 21 days, then you should consult your doctor. Sometimes periods are not occurring at all. That means primary amenorrhea, when patient is girl is not getting period up to the age of 15 years or 2 to 3 years after thelarche, then she should consult the doctor. Then obesity, definitely if you feel like your weight is increasing abruptly, or you are getting massive acne, or you feel like you are developing facial hair growth or the male type of hair pattern on your legs or arms, you should consult your doctor. Now what doctor does? So basically your doctor take a full clinical history about your menarche, your cyclical irregularity, and your breast development, some information from you. Then she will do your physical examination just to see the appearance of axillary hair, pubic hair, and the development initiation of breast nodule. And this is just to rule out the other pathological conditions which mimic the PCO. And then the second parameter is biochemical markers or the lab investigations your doctor advised. The most common lab investigation which is advised in PCO is free and total testosterone level, then serum TSH and prolactin levels, then insulin and glucose tolerance test. Then there are some other investigation also like DHEA and sex hormone binding globulin are also advised. Similarly, 17-hydroxyprogesterone is also advised. This is a panel of investigation we are advising in PCO. Then the third parameter is sonography. So in sonography, in a patient of PCO, what we get is the peripheral arrangement of small follicles, which are basically immature follicles. They are arranged in the ovary. And but let me very clear that for up to 2 years of the menarche, sonography is not generally advised, because this is the normal pubertal transition period, and around 30 to 40% of females normally present with the appearance of PCO. So definitely after 2 years, it plays a great role. Now to come the diagnosis on the, if out of these 3 criteria, if 2 criteria are fulfilling, then definitely we label the girl as PCO. So this is about the diagnosis of PCO. Now what we get with the early diagnosis of the PCO? See, if we diagnose the patient in the early stage, we can prevent the further complications she can get in adulthood. The most important complication is type 2 diabetes mellitus, and the obesity, then the cardiovascular symptoms and hypertension. Then definitely because of the unopposed estrogen levels, she may develop endometrial hyperplasia, and because of anovulation, infertility prevails. Then because of all these complications, girls psychologically, it impacts psychologically on a girl, and that is also a major complication in PCO. Now come on the treatment part. If we come on the treatment part, generally doctor prescribe combined estrogen progesterone pills to the patient, and these estrogen progesterone combined pills, they help in the this hormonal disturbance. They regulate the hormonal disturbance, and by regulating the hormonal disturbance, definitely they will treat cyclical irregularity and hirsutism and acne also. And the second line of management is metformin, which is basically treat insulin resistance in your body. And by treating insulin resistance, definitely it improves your hormonal imbalance, your cyclical irregularity, hirsutism, acne, and also obesity. Certain other treatments are also given, but generally in adolescent girls, these two medicines are generally given. And some local creams like eflornithine type of creams are also advised just to prevent the facial hair growth. Otherwise, the normal waxing and laser treatment generally advised for the hair growth. Now, let me very clear that there is actually no cure for PCOS. We can only manage the PCOS according to the patient's age, then according to her need and the priorities. Like in your age, like in adolescent group of patient, generally our aim is to treat the cyclical irregularity. And if a girl is getting at least 4 to 5 period in an year, then definitely there is no need to treat, because it will check her endometrial hyperplasia by its own. Like if the girl is not getting 4 to 5 period, then definitely we should give medication to her, and the aim is to get at least 4 to 5 cycles. Means she should get at least 1 cycle in 3 months. This is just to check the endometrial hyperplasia and also for the ovarian and uterine health. And but similarly, if we talk about the adult age, then definitely the focus is for the management of infertility and other symptoms. So it depends upon the patient's need, the age of the patient, what treatment should be given. Then the most important thing in PCOS is that as there is no cure, but by the lifestyle modification, we can check this PCOS process. And so in this lifestyle modification, the major entities are diet and exercise. And I think Medhavi will deal with that. And I think this is all over about the PCOS in brief. I should switch over to next speaker. Thank you.
Yeah, Dr. Gaur?
Yes.
Yeah, hi.
Yeah, hi.
What do you have to say about this in continuation with what Dr. Shikha?
Definitely. Dr. Shikha has explained it so well. So it talks about everything about what PCOD is. So here, I would like to talk about the effects of PCOD. You know, in any of the illness, any illness, I would prefer to use both the languages. So I'll tell you about it, that whenever we suffer from any illness, the first thing is the shock. And that too, if the illness is chronic. The first thing which comes in the mind, oh, now what? Ab kaise hoga? Ab kya hoga? Kaise karenge? So then there are the effects of shock, a disbelief develops, gussa aane lagta hai, anger develops, frustration, sadness, the numbness, fear. These are all the feelings which chase each other. That comes one after the other. The moment you get to know that you are suffering from some kind of illness which is chronic, which doesn't have any cure, and that creates a lot of chaos in the mind, that creates a lot of stress in the mind. And that stress, and what is stress about? What is stress? Stress is basically a fear of that feeling कि कैसे होगा, अब क्या होगा, अब मैं क्या करूंगी, how will I spend my life, I'm just an adolescent, I'm just a teenager, or I planned my life that I would be a mother of 2. I planned my life in certain, there are certain plannings for the life. When these things are not happening, and when you get to know that you're suffering from a disorder, that this might disturb your life plannings, so that brings a lot of stress. Stress is again the assumptions of the thought that what will happen now, what will happen now. And when that stress overleads, when that stress overpowers you, that may they're connected, that may lead to anxiety also. Anxiety is the feeling of fear, then it is always floating, and anxiety hampers our daily living also. हम कुछ भी काम कर रहे हैं, and as I think our maximum of the audience are students, as Shilpa told that schools are there, so these students must have faced anxiety very well. सबको पता होगा कि anxiety क्या होती है, सब एग्जाम देने जाते हैं, इनफैक्ट हम सब ने एग्जाम्स दिए हैं, हम सबको पता है व्हाट इज एंजाइटी. वी फील एंग्शियस, देयर इज अ इरिटेबल प्रॉब्लम होता है कि बार बार आपको यूरिन जाना पड़ता है, यू आर स्वेटिंग इन योर हैंड्स और यू आर शेकिंग योर लेग, और देयर इज अ थॉट और देयर इज अ फीलिंग दैट यू हैव फॉरगॉटन एवरीथिंग, अब याद नहीं है, अब क्या होगा, अब कैसे होगा. तो ये एंजाइटी जब प्रिवेल करती है, व्हेन दिस प्रिवेल्स, दिस हैम्पर्स द डेली लाइफ आल्सो. When we are doing something, when we are going through our work, our schedule, our daily routine, we tend to forget things. हम अपने काम में, अच्छा हमने चाबी कहाँ रखी थी, हमने अपनी पेंसिल कहाँ रख दी है, where did I keep my notebook? Or if it's a homemaker, she would skip any of the work because she's anxious, she's into some other thoughts. So this is accompanied by all these thoughts, all these feelings, anxiety. And when an anxiety is uncontrolled, and when that stress is uncontrolled, some stress is important for our life because that helps us to do the work. And if we do not have stress at all, we won't get ready in time, we won't go to the office on time, we will not, I would have not been here present in time in front of all of you अगर वो थोड़ा सा स्ट्रेस नहीं होता तो. तो ये थोड़ा थोड़ा स्ट्रेस बहुत इंपॉर्टेंट होता है, लेकिन यही स्ट्रेस जब हमारे ऊपर हावी होने लगता है तो हमारे थॉट्स को, जो नेगेटिव थॉट्स हैं, उनको प्रमोट करता है. And when the negative thoughts keep coming in mind, and for a persisting time, for a longer period, जब वो लंबे समय तक चलने लगता है, then it causes depression. Depression again is important to know. हम लोग बोलते हैं सबसे बड़ी बात क्या होती है ना, psychological problems के साथ या mental health issues, mental health problems के साथ, people don't have acceptance. We don't have acceptance that, oh, we can have something like that also. And it is often seen, many of the researchers researchers have taken place which talks about PCOD and the mental stress. So because of that mental stress, the psychiatric ailments, which are the comorbid factor, I think Dr. Shikha will agree to this, that psychiatric illness and these depression and anxiety and stress and body shaping and all these imaging, all these things are the comorbid factors with PCOD.
Yeah.
So इन चीजों पे हम लोग फोकस नहीं करते हैं, या जो लोग सफर कर रहे होते हैं वो ध्यान नहीं देते हैं, तो दैट माइट गेट इनटू अ लॉन्ग लास्टिंग, अगेन फ्रॉम वन यू आर हैविंग वन प्रॉब्लम और उसके साथ आपकी दूसरी क्रॉनिक प्रॉब्लम और डेवलप हो सकती है अगर ये बहुत लंबे समय तक अनट्रीटेड रह जाती है तो. एंड मेनी टाइम्स it stays untreated because focus is just on one ailment, one problem. So the negative thoughts, the repeated negative thoughts leads to depression, and depression just not affect your thinking. Depression also affects your emotional well-being, your social well-being, your relationships, your physical ailments, your eating, everything. Depression affects in your daily day-to-day routine life. जो डिप्रेशन से सफर करता है उसका हर चीज से मन उठ जाता है, मन नहीं करता. You feel like you're lethargic, you're lazy, you will not feel like getting up from the bed, उठने का मन नहीं करेगा, नहाने धोने का मन नहीं करेगा, अच्छा ये काम करना है चलो बाद में कर देंगे. It's better that we sleep, we take rest. A feeling of rest, a feeling of this comes when it is on your emotional factors. You develop the feeling of worthlessness. नेगेटिव इतना होता चला जाता है अगर टाइम से वो कंट्रोल नहीं होता है कि अपने अंदर ही डेवलपमेंट आने लगते हैं कि ओ आई एम होपलेस, आई एम वर्थलेस, I'm good for nothing, I'm already having so many ailments, comorbidities बहुत सारी अभी डॉक्टर शिखा ने भी बताई थी कि उन सब के चलते हुए, और जब वो जो सेल्फ एस्टीम खत्म हो जाता है, कॉन्फिडेंस खत्म हो जाता है, तो वो सबसे बुरा होता है because that doesn't let you do anything. You stop all your social relations also. You do not feel like talking to your friends, you do not feel like talking to your relatives, you do not feel like moving out, you don't feel like attending the parties. Why? Because you feel that, oh, I have this illness, and because of this illness, इसके जो effects होते हैं, negative effects, that you develop with your obesity, you weight gain होने लग जाता है, या there's hair growing, which you feel like कि नहीं, I'm giving a masculine look. तो अपने आप से जो शर्म आने लग जाती है, अपनी बॉडी से जो शर्म आने लग जाती है, उस चीज को और सोचते हुए ये प्रॉब्लम और क्रॉनिक होती चली जाती है. So it is important to have this mental well-being and emotional well-being. It is very important. So now I come down to how can you cut down to these thoughts when we're talking about stress, anxiety, depression, and we're talking about the emotional mental well-being. So how can you cut down to grow the well-being? So for most important thing, of course, the diet, if it is taken well in time, Dr. Medhavi would be talking about the diet part. So if you're taking food well in time, if you're taking care of your body well in time, and most important thing is if you're taking care of your thoughts. And how can you take care of your thoughts? हम लोग, मेरे पास बहुत सारे लोग आते हैं, वो आके यही बोलते हैं कि हम थॉट्स कैसे कंट्रोल कर सकते हैं, वो हमारे बस में नहीं होते हैं. एंड इट इज ट्रू. इफ समबडी इज सफरिंग फ्रॉम डिप्रेशन, तो वो जानकर तो सफर नहीं कर रहा है, वो थॉट्स जानकर तो नहीं ला रहा है, बट एट द सेम टाइम व्हाट आई टेल देम इज कि आप थॉट्स जानकर नहीं लेकर आ रहे हो, बट उसको कम कैसे करना है, उसको मैनेज कैसे करना है, वो तो हम कॉन्शियसली कर सकते हैं. सो important thing is to know your conscious thinking, because all the thoughts which keep on coming in mind all the time, they are giving a message to your body that you have to act this manner. अगर आपके वो नेगेटिव थॉट चलते जा रहे हैं और आप उसको रोकने की कोशिश कर रहे हैं, आप अपना सारा एनर्जी उसके अंदर लगा रहे हैं, तो देयर इज सेम थिंग. आप उसको सोच रहे हैं या आप उसको रोकने के लिए भी उसी को सोच रहे हैं, तो रुक तो कहीं वो रहे नहीं है. So in at that point of time, I tell them that don't try to stop your thoughts. Let them just go like the wild horses. Let them go as far as they want to go. Don't try to stop them. Rather, get something else. Think something else. You know, there are many thoughts in our brain which are coming. तो उसमें से हम कोई एक ऐसा थॉट पिक कर सकते हैं जिसके बारे में हम सोच सकते हैं, which gives us a feel good factor. वो हमारी थिंकिंग है जिसको हम बोल सकते हैं कि वी कैन गिव आवरसेल्फ इन अ बेटर वे. सो दोस थॉट्स cannot be stopped, but they can be managed, and they can be managed by spending our time with different things. So even if we are not feeling like getting up from the bed, we must do that, because if we give our thought the same thing, अगर हम अपने थॉट्स को वही सोचते जाएंगे, तो वो थॉट्स सबकॉन्शियसली हमारे अंदर इतना ज्यादा बढ़ जाएंगे कि हमारी सबकॉन्शियस thinking is much more powerful, that which will make us feel that yes, we are definitely suffering from this thing, yes, definitely we cannot do anything, yes, definitely we are good for nothing. And when this hopelessness and worthlessness develops, we actually develop that boredom in our life, that we feel and we make sure and we make others feel sure that yes, they are good for nothing. We cannot let that happen to ourselves. You know, I often talk about self-love, and right now I'm not going to discuss about it, because that is another factor which helps in coming out of depression. अगर वो डिप्रेशन हमारे कंट्रोल में नहीं है, अगर हमने अपने थॉट्स को दूसरे थॉट्स के साथ अपने पॉजिटिव थॉट्स को, या अपने फन लविंग थॉट्स को, या अपनी फन लविंग मेमोरीज को, या मे बी आवर म्यूजिक, और मे बी द डांस, द फिजिकल एक्टिविटीज, दीज एक्सरसाइजेस, we compensate our thoughts with all these things, we might develop a feeling which encourages us and which beats our worthlessness, which beats our hopelessness, and will develop a better confidence. So why do I focus more on exercises? Why do I focus more on such activities which has multiple roles to play? Say like entire lockdown, our Facebook was full of, or any of the social media was full of cooking stuff. सब अपने घर में बहुत कुछ अच्छा अच्छा बना के और प्रेजेंट कर रहे थे कि आज ये बनाया, आज ये बनाया, आज ये बनाया. How is it associated to this? I'm talking about, because we're talking about beating the stress and depression, so it is associated to it. PCOD also accompanies with stress and depression. So here, the act of cooking is a feeling. You like something, you get the praise. Because you get the praise, you feel good. A feel good factor adds on. After getting the praise, just with the picture, again adds on the feel good factor. And if your family is tasting it and eating it and then praising, it adds on again, right? And then you have so many compliments coming up. So your own satisfaction of cooking, your appreciation from the family members, and the appreciation from the social media, and attending the personal phone calls or demand for the food to be made up again. So these are so many factors which involve so many emotions. And when there are so many emotions, that adds on to our happy hormones, which helps in beating the depression out. So it is important that while you are in the phase of stress and depression and anxiety, it is better to beat on your anxiety and depression by such factors rather than just focusing on those thoughts कि आज मुझे दिन भर से क्या क्या नेगेटिव थॉट आया. हम वो सारे थॉट्स फोकस ना करते हुए अगर अपने आप को इन एक्टिविटीज में इन्वॉल्व करेंगे तो इट्स गोइंग टू बी बेटर फॉर अस. Then I talk about the physical exercises also. Why do I talk about exercises? Because they generate endorphins in our body, which are again the hormones which help us in feeling good, feeling happy. So this is another happy hormone. तो जितना हम फिटनेस करते हैं, जितना एक्सरसाइजेस करते हैं, साइकोलॉजिकली अपने आप को उतना फिट रख पाते हैं. So there are many factors which play a very important role in all these things. Another thing, most important thing is to question yourself. अगर आप अपने आप से सवाल करेंगे, how will you know कि आपको ये प्रॉब्लम है? How will you know that you're suffering? अगर हम इस चीज पर ध्यान नहीं देंगे और ये हम सफर कर रहे हैं सेलमेंट से करते जा रहे हैं and we're not thinking about it at all that oh we are suffering from something else, because psychological जो mental illness होती है it is not visible by others, you know, others cannot see it. Fracture होता है, fever होता है, body को feel करके feel कर सकते हैं, the leg is broken, so the plaster shows that the leg is broken. But if somebody is going through some stress, some depression, nothing can tell you about it. No CT scan, no MRIs, no any other thing can tell you about this, that you are suffering from depression or you're suffering from some kind of stress or tension. It is your behavior. So it is important that family members should notice the behavior of each other. If you find that there is some change in behavior, not talking to people, trying to stay by yourself, you're happy in your room, and that too in a shabby room. You don't feel like cleaning your room, you don't feel like dressing up yourself, you don't feel like doing certain things, you know, which used to attract you earlier. So these are some of the things how you can understand that somebody is going through some kind of problem and notice that person. And if that something that if these features are persistent and are going a long period of time, आपके एफर्ट्स के साथ भी मैनेज नहीं हो पा रहा है, तो आपको एक्सपर्ट्स की हेल्प लेनी ही पड़ती है. And you can go to your doctors, they can advise you to see some good psychiatrist or some good psychologist where these things can also help them out with. So now this is what others can do it. Now if you yourself are suffering from this, if you yourself are feeling from going through these kind of problems, what are you going to do? There are certain things, certain questions what you're going to ask yourself. First thing what I generally ask, that what are you going to ask yourself is, do I feel down, depressed or hopeless? आप अपने लिए अपने आप से सवाल करिए that do I feel depressed or do I feel hopeless? And if you feel that yes, then come up to the next question. Do I feel worthless? I'm not worthy of doing things? Or have I decreased with my capacity of the production of the work, the amount of work I used to do earlier? Am I able to do the same amount of work now? Have I lost interest or pleasure in the activities which I used to enjoy earlier, which used to give me a boost, which used to give me, a feel-good factor, and I used to love doing it, leaving everything? Do I worry about these things, that how do I look? This would be another question. Or do I feel guilty, depressed, or disgusted about my own body, about my own things? If you have these questions, yes to these questions, then you must work on it the way I've told you. Then another something good, there has been a research which talks about that more the obesity increases, the level of frustration also increases. It has been seen. And because obesity increases, because there are some hair on the body, people do feel, you develop that, people develop body shaming. Do you think body shaming is that important? You need to be so torturous to yourself. You should be kind to yourself, not that torturous. आपकी body अपनी है, और अभी डॉक्टर शिखा ने तरीके बताए थे कि कैसे आप उन सब चीजों को वर्कआउट कर सकते हैं. If you have excessive hair, we have treatment for everything now. उन सबको कर सकते हैं. But if you're kind to yourself and if you are loving yourself, you will never have that feeling that no, with this body I won't look good. इसमें मेरे कोई कपड़े नहीं आएंगे. मैं बाहर सबके सामने आऊंगी तो लोग मेरी हंसी बनाएंगे. मेरे फ्रेंड्स क्या बोलेंगे? My friends look so fit. My friends, when they post their pictures on Instagram, on Snapchat or Facebook, they look perfect. Come on, do not believe on all that, because all the pictures are not real. We have so many filters these days, and we have might be they are Photoshop pictures. Who knows about it? Do you think all the actor and actresses look the same way as their pictures come out? So it's okay. It's okay if you're obese. It's okay if you're a little healthy. What is more important is to feel happy from inside, feel good for yourself, so that you can beat up the stresses, so that you can help your doctor for a better treatment. I mean, I'm talking about the gynecologist, because even if they are treating you, and you're happy, and if you beat up your psychological problems, then the treatment for them will be much more easier. Then what is with the psychological ailments? If the psychological ailments are untreated, if the psychiatric ailments are untreated, even the gynecological treatment becomes difficult. And उसके अलावा हम बहुत सारे दूसरे problems और develop कर लेते हैं. So I think with that I would I think it would be too long if I talk too much. So एक चीज जो बहुत important है, अपने आप को be kind to yourself, be generous to yourself, and just love yourself in whatever shape, in whatever form you are. Keep yourself active. Don't let your thoughts overpower you. Rather, you overpower your own feelings, your own thoughts, by looking at the conscious things and putting those conscious things in your subconscious, rather than letting those negative thoughts get into your subconscious, so that they do not rule your body. Your conscious thoughts should rule your body, should rule your brain. So I think with that I end up, and I would pass over it to Dr. Medhavi. She must be having much to tell about the stress thing also, and of course about the diet and the gynec, whatever the diet should be taken. Thank you so much.
Thank you, Dr. Gaur. That was very, very informative, and I'm sure lots of children who are watching this, and even the parents who can help their children come out of this gloomy phase, which most of the children nowadays do go, will definitely help them. And now coming to the nutrition part, Dr. Medhavi would suggest that how children what they should intake and what they should not intake to build a better body. So over to you, Medhavi. Gautam.
Thank you, Shilpa. And really, I should appreciate Dr. Shikha and Dr. Manisha. So they have done my job. I mean, it's now very easy for me to explain, because although I'm talking about diet, but it is very important to basically know what PCOS is and how psychology impact when we are talking about PCOS, because these are some particular things which I will surely tell you how it actually impacts our health when we talk about our diet and nutrition. To start with, the most important thing is that when you're talking about PCOS, because since now we've been discussing from so long that PCOS, there is a lot of involvement of insulin, there's a lot of involvement of your weight, everything actually goes haywire when you talk about PCOS. The most important is that you have to see this thing. While diet is concerned, I'll pick 2-3 things precisely. First is the management of weight, because that's the most common thing which happens when you have PCOS or PCOD, you might have weight gain. That's very important. And even if you don't have a weight gain, it's so important to keep a maintenance of weight whenever you're talking about PCOS and PCOD. So first is the management of weight, and second is management of your, because as I've come across in so many years, we've been practicing, people are so much concerned about their skin, they're so much concerned about their looks, they're so much concerned about their body. Like it was already mentioned by Dr. Manisha, that body shaming is a very common thing. So I'll just highlight on these things. So first thing is, when you're talking about a diet for PCOS, you have to think about some particular nutrients. So now we will be talking about everything. What normally people do is they stop eating, they follow some or the other kind of crash diets, they go on some or the other kind of such diets which eventually do not help them so much in reducing weight or maintaining the PCOS levels, but they definitely give a toll to their health when their nutrition levels are concerned. Then micronutrient deficiencies are very common when you see a PCOS person. So you have to take care of all these things, especially whenever you have to do. The first thing is that you have to cut down on your carbohydrate levels. Now, not just cut down, it's basically to manage your carbohydrate levels. Now, basically how to manage your carbohydrates. I don't say that you have to stop on your carbohydrates. No, absolutely not. You have to have a good amount of carbohydrates. But the carbohydrates should be precisely complex carbohydrates where they are giving you more of fiber, good amount of energy, but they are not giving you too much of calories. Involvement of calories. So you have to pick those carbohydrates which are lower on the calories. One, so it has to be more of complex carbohydrates. You have to pick those foods which are low on the glycemic index. Now, what do I say about what is basically glycemic index? Glycemic index hota hai, this is basically capacity, what kind of food, how quickly it gets absorbed in your body and it raises your blood sugar. तो हर एक फूड का एक ग्लाइसेमिक इंडेक्स होता है. कुछ जो होते हैं वो बहुत जल्दी से आपका शुगर बढ़ा सकते हैं, कुछ होते हैं which takes little time, and some foods take longer time to increase your blood sugar. So you have to take this thing very important point is this, that you have to see that you are taking a low GI food. Why I'm talking about low GI food is because you have to see two parameters in PCOS. One is this, that there's a lot of impact on your insulin resistance, which Dr. Shikha was mentioning. Insulin resistance is one thing which happens in PCOS ladies, PCOS women who are suffering with PCOS. So there's that what is insulin resistance? Basically, it's the capacity of your cells. कि आपका cells जो है, उनका capacity insulin को लेने का कितना होता है. So it goes down. So then because of that, there's an imbalance in the blood sugar. And because there's an imbalance in the blood sugar, there might be increase in your weight, there might be increase in your blood sugars also. So you are prone to have diabetes, you are prone to have more of weight. So you have to maintain your blood sugars. So that is why it's important to have a low GI food so that you maintain your blood sugars. The insulin resistance is then managed, and your weight is again managed because of this. So you have to use a low carbohydrate or a moderate carbohydrate food with higher complex carbohydrates and lower GI foods. That's the first point to be taken in consideration. The second nutrient which comes in the list is the proteins. That you have to have good amount of proteins. Now that doesn't mean, I don't say that's a high amount of proteins. Because people to me come, they say that हमने carbohydrates कम कर दिया, हमने fats कम कर दिया, हम बहुत अच्छा प्रोटीन ले रहे हैं, हम जिम कर रहे हैं, हमारे जिम वाले ने भी बोला है कि खूब अच्छे से प्रोटीन खाओ. Protein खाओ आप, definitely लो, because it is very important to have a good amount of protein, because protein is again going to help in keeping your stabilizing your blood sugar levels. Also it will help in giving fullness. एक fullness का, it will increase your fullness after taking meals. तो आप खाएंगे तो आपको लगेगा I've had enough, so I don't have to have more. तो आप अपने आप आपका carbs content जो है वो धीरे-धीरे कम हो जाएगा. So you have to have enough proteins, but it should be a good quality protein. So it's basically that you have to believe in the quality then the quantity. खूब सारा नहीं खाना है, थोड़ा खाना है, लेकिन उतना खाना है that gives उसका आपका impact पड़े body पे. So it's more of a qualitative protein than the quantity. So it's a high biological value protein which कि हम थोड़ा भी खाएंगे तो जल्दी से absorb होगा. Like it's good in your eggs, it is good in your legumes, it's good in your pulses, like whole pulses like soybean हो गया and all these things. So they have good amount of proteins in there, and milk and milk products. Obviously, you have to don't compromise on them, saying that कि इसमें तो fat होगा और मैं और ज़्यादा मोटी हो जाऊँगी, because that's very common in I should say it's more of a myth in people that because of milk we get fat. हम सब कुछ खा लेंगे, खाने के अंदर हम we'll eat everything, but we'll not have milk. हम दूध क्यों नहीं पी रहे हैं? इसलिए नहीं पी रहे क्योंकि मैं मोटी हो जाऊंगी and I have to maintain my weight. Doctor has asked me to maintain my weight, so I'm not taking milk. Do not do that. You have to have a good amount of protein. So it's like qualitative, more of qualitative protein. तो आप लेंगे तो it gives you a feeling of satiety and fullness also. So that's about proteins. Next come your fats. Of fats, and now yes, it is very important that you have a good amount of fats, but the fat should be a healthy fat. बहुत इंपॉर्टेंट है. देखो अभी की जैसे हम बात करें वेट मेंटेनेंस की, हम बात करें इंसुलिन रेजिस्टेंस की, हम बात करें ब्लड शुगर्स को मेंटेन करने की, एंड देन आई एम सेइंग फैट. तो ये तो बड़ा कॉन्ट्राडिक्टरी स्टेटमेंट हो गया, बट इट इज सो इम्पोर्टेंट टू नो दैट योर फैट शुड बी अ हेल्दी फैट एंड इट शुड बी आल्सो इन मॉडरेट अमाउंट्स. एकदम नेग्लिजिबल अमाउंट्स में आप फैट खा रहे हो, वो भी दैट फैट विच इज अगेन नॉट गिविंग यू टू मच ऑफ क्वालिटी एंड इट्स जस्ट गिविंग यू कैलोरीज. सो यू हैव टू हैव अ healthy fat. Healthy fat means fats which are rich in MUFAs and PUFAs, like your omega-3 fatty acids ho gaye. They are all healthy fats, so that you get from your nuts and oil seeds. You'll have it from your almonds, your walnuts. You'll have it from flax seeds. You'll have it from different seeds like sunflower seeds, and so many seeds are in list. तो आपको ये fats consume करने हैं यहाँ से. So you have to concentrate more on MUFAs and PUFAs than your saturated fats, which saturated fat basically आपका क्या हो गया? All those fats which are solid at room temperature. तो आपका घी है, आपका butter है, आपका margarine है, आपका hydrogenated fats है. These are all saturated fats which obviously you have to cut down. वहाँ कम करना है, but MUFAs and PUFAs आपको अच्छे से लेना है. Again, why? What is the reason of taking a healthy fat? Because again, if you're taking a healthy fat is like, fat has more amount of calories in comparison to your carbohydrates and your proteins. This is for sure. आप 1 ग्राम फैट लेंगे तो आपको 9 कैलोरीज मिलता है. आप 1 ग्राम प्रोटीन या आप कार्बोहाइड्रेट लेंगे तो आपको 4 कैलोरीज ही मिलता है. So your it is getting higher amount of calories when you're consuming fat. Now I'm saying a healthy fat. तो आप healthy fat लेते हो, आप 1 ग्राम लोगे, so it's giving you MUFAs and PUFAs and your essential fatty acids which we want for our body's metabolism. And it is also giving you 9 calories, which is again increasing the calories and increasing the satiety levels and increasing the space, food space, So that is why आप अगर थोड़ा सा healthy fat increase करके diet लेते हो, so you will get more calories, which would be healthy calories, and you will lose on your those unhealthy calories, or I should say those calories which unnecessarily you will get from your carbohydrates and extra amount of proteins, right? So have good amount of healthy fat in your diet. So again, I said it should be your nuts, oil seeds, and more of these based, like avocados. They are good fats. Then your olive oil, and not just olive oil, your canola oil, and all the sunflower or safflower oil, any oil you put. So these are all MUFAs and PUFAs you should involve and get in your diet. So that's about fats. Next I would touch is your fibers. That's very important. हम जब बात करें, ये तो हमारे macronutrients थे, हमारा proteins हो गया, हमारा fats हो गया, हमारा carbohydrates हो गया. Now I come on the micronutrients, and that's the most important in the list. And obviously it's a fiber is again a form of carbs, I should say. So you should have a high amount of fiber. High amount of fiber, again उसका 2 reasons है. हमने बात करी इंसुलिन को मैनेज करने की. So whenever you're talking about high fibers, it's again helping you to maintain your insulin levels, maintain your blood sugar levels basically. So high amount of fibers will maintain your blood sugar levels, and your insulin resistance is improved again. More is your amount of fiber in the diet, you will have a better satiety. आपको fullness बहुत जल्दी मिलेगी. आप खाना खाएंगे, if you have a high fiber diet, you will feel full much faster than having a diet without much of salads or without much of fiber. So the core fiber has to be increased in your diet. One, to increase the satiety, to increase the fullness of your diet, and to help your blood sugars to get maintained. So help your insulin resistance, and also to manage your weight. So your weight management is very important. So more fiber you take, less you eat, better you will control on your weight and your extra calories which you consume in your diet. If you're not having a good fiber diet, if you're not having you're not having enough fibers in your diet. Also fibers, they play a very important role in your diet, because I will be now touching on one more point, and that is to eat more of fermented foods or more of foods which are rich in probiotics, because that is very important to keep your gut flora healthy. There have been many studies which have come across where it shows that people, the women with PCOS higher chances of getting a poor gut flora or a poor gut system, because they do not have enough of healthy bacteria, their healthy gut bacteria. So it is so important to have a good probiotic diet or a fermented diet, or I should say a high fiber diet. Again, why? Because more of fiber you take. Probiotics kya hota hai? Probiotics are healthy bacteria which we take for our gut to be healthy and happy. तो नेचुरल प्रोबायोटिक जो हमारे को मिलता है, जो डाइट में सबसे कन्वीनियंटली मिलता है, दैट इज योर दही. You get dahi, that's at everybody's hands reach, and that's a natural probiotic to us which keeps our gut flora maintained. That's one thing. But probiotics के लिए भी बहुत जरूरी होता है prebiotics, which is like food of probiotics. तो जब तक आपको prebiotics available नहीं है, तो वो आपका probiotics बहुत good quality या healthy probiotics नहीं रहेंगे. And what are prebiotics? Are basically fibers. So if you have to have good probiotics, if you have to have a good gut flora, you need to have a good amount of prebiotics also. So your prebiotics and probiotics both are involved to keep your gut flora good. Better is your gut flora, better is your resistance to food, better is your gut health, better would be absorption of your food. So आप कम भी खाएंगे, so that will get absorbed quickly, and it will get absorbed nicely, and it will actually give your impact for what we are eating, you know. So you have to have a good, and then again आपका probiotic मैंने कहा दही में तो होता है, साथ साथ में fermented foods में भी अच्छा probiotic मिलता है हमारे को. So fermented foods are like अपना South Indian cuisine is all fermented foods. Idli, dosa, uttapam, appam, these are all fermented foods. And your even the Gujarati thali, like you have doklas, you have khandvis, these are again fermented foods. So आपको you have to incorporate more of ferment, and अपना regular fermentation में जो अपने घर में काम में आता है, हम कांजी लेते हैं. So kanji is a fermentation process. Then we have chach, then we have rabri. So these are all things where you are increasing probiotics in your diet. Okay, so this is like natural things available to us, and you don't need to have any fancy probiotic buying from market and having that one day and you say I've had enough probiotic because so and so actress is saying कि ये वाला लोगे तो आपका एकदम gut flora healthy रहेगा. You have everything at your hands reach, just have it and take it. So this is about your fermented foods and your probiotics. You need to be very, very cautious when you're choosing your foods when you are having PCOS. Next is that you have to practice your mindful eating. You know why I'm saying mindful eating बहुत important है. हम इतना परेशान हो जाते हैं PCOS में कि क्या खाएं. You know there are so many questions in our mind running कि मैं ये लूँ, मैं ketogenic diet ले लेती हूँ, मैं I'll do GM diet or I'll do a General Motor diet or I'm doing a Atkins diet. I mean, so many things keep running in your mind just for one reason, that I have to lose weight faster and I have to keep a maintenance of my weight. But that's not the answer. That's not the answer at all, because यही होता है जहाँ problem हो जाता है, that we are actually not focusing on exactly what to eat, and whenever we are not eating mindfully, we go into a wrong direction. और इट्स सो इम्पोर्टेंट हमारा ये जो ज्यादा वेट के चक्कर में या हम जो हिट एंड ट्राई करते रहते हैं उसकी वजह से देयर सो मेनी देयर आर सो मेनी स्टडीज व्हिच हैव बीन डन ऑन PCOS women where it has been shown that women with PCOS have higher chances of getting eating disorders than the women with normal PCOS. Now eating disorders, I'll briefly tell you, it's again a psychological disorder. Moreover, इसके अंदर आप वेट को लेके इतने कॉन्शियस हो जाते हो that you either stop eating food at all, आप बिल्कुल खाना बंद कर देते हो just because that I need to look good, or you eat so much so that you binge on food. आप इतना ज्यादा खाते हैं and then what happens, आप binge तो कर लेते हो, you are a party animal, you don't want to show people that I am trying to control on my weight, so you eat so much and then you come back home, you puke it by some of the meals and everything comes out, and which is even worse. So eating disorders are so common, which eventually happen when you have such a finicky about your weight, finicky about how you look. Like body shaming was discussed by Dr. Manisha. So it's so important. देखो मैं तो जब भी बात करती हूँ ना, I say one thing which is very important is एक डायलॉग याद रखो, मैं अपनी फेवरेट हूँ, करीना कपूर का, जब भी मेट का, याद है ना सबको डायलॉग. I mean, you should always think this, like it was mentioned by Dr. Manisha, that you should appreciate yourself, and looks actually don't matter. Looks actually don't matter. Right now in PCOS, what is important is maintenance of your weight, because we don't want to increase the levels of our hormones, of our PCOS in the body, and that's why we are maintaining our weight. Not that I want to make you look beautiful and all. You are beautiful, but the only thing is important is that do not take it to that level that we get ourselves to some kind of eating disorder problems. So mindful eating is very important. होता क्या है कई बार ये भी हो जाता है इसमें that if you are not doing it properly, there's increase in two hormones. There are very important hormones. One is your ghrelin hormone and one is your cortisol hormone. These are two hormones which are so important whenever we talk about our weight. Ghrelin hormone and cortisol hormones, they दोनों hormones तब आते हैं आपके जब ghrelin is basically hunger hormone. तो आप जब भी ये हार्मोन हमारा बढ़ता है तो we feel hungry. हम इतना ज़्यादा भूखा फील करते हैं that we eat anything and everything which comes in front of us. Cortisol again is hormone which is more released when you are under too much of stress. और ये हार्मोन रिलीज होता है तो again आपका eating pattern जो है वो change हो जाता है. You eat so much so that you have no control over it. So you have to be very mindful when you're watching, when you're trying to think about maintaining your weight or maintaining your blood sugar levels and everything, and maintaining your PCOS as far as the diet is concerned. One more thing which is very important is you have to limit your processed foods. You have to limit your sugars. That's very important because sugars as it is not giving you anything except for your calories. Sugars, as I said, is again a form of refined carbohydrates or say the complex, simpler carbohydrates. Like I said that you have to increase your complex carbohydrates and reduce your simple carbohydrates. That was my first thing. Sugar comes in there only. So you have to reduce down your sugar intake. And what is all more important is whenever you are taking sugar, instead of taking sugar, better is you take honey or you take jaggery because as far as the calories are concerned, all the three are same. Important is that honey and jaggery are giving you other important minerals, micronutrients, which your sugars are not giving you. They're absolutely refined. So honey would probably give you micronutrients, your jaggery would give you iron. So that's again an important micronutrient to be consumed by women. So that's a better option. Do not take too much of sugary foods and processed foods. Absolutely not. हम जब stress में होते हैं, हम जब mindless eating कर रहे होते हैं, हम लोग munch कर रहे होते हैं, we don't even realize that what exactly we are taking. हम लोग chips भी खा लेते हैं. We are more on fried stuff also. We are on anything ready to eat at our hands reach. So first thing is just do not get these things at home क्योंकि आप जब सामने होता है तो खाते हैं, नहीं होता है तो check your groceries, what you are buying, make a list of things when you are going to buy your groceries, and do not get such things which are highly processed because they are increasing on your sugars. They are also increasing on your sodium levels, which again are very important to be considered. Like it was mentioned by Dr. Shikha that hypertension is again a very common thing in PCOS. It happens there. So you need to be very cautious while you're eating that you're not taking too much of those things which are increasing your sodium load also. Salt तो as it is आपको moderate रखना ही है, पर processed food रहते हो तो होता क्या है कि ये processed foods को बनाने के लिए और उनका shelf life बढ़ाने के लिए ज़्यादा sugar और ज़्यादा salt डाला जाता है so that the shelf life increases and it's good, tasting good and in quality for a longer period of time. But we are taking these processed foods and we are exposing ourselves straight away to high amount of sugars and high amount of sodiums, which we don't have to do because we have to maintain our blood pressure levels also. Very important to be considered. Next is to reduce your inflammation. Now inflammation से क्या मतलब हुआ है ना? Inflammation क्या होता है? This is actually a response of our body to any kind of infection or injury which happens in our body. That's a common response. But why in PCOS? क्योंकि PCOS क्या है? इसमें एक chronic stress रहता है हमारे को. Chronic inflammation रहता है. PCOS में the ladies have this chronic inflammation, and because of that again there's a lot of chances you might have a weight gain, or again you have a chances of getting a poor insulin resistance. So it's so important again to keep a check on your sugar levels and to keep a check on your carbohydrate levels because again these two things contribute to the levels of inflammation in the body. तो आपको फिर से अपना कॉम्प्लेक्स कार्बोहाइड्रेट्स रखने हैं, सिंपल कार्बोहाइड्रेट्स कम रखने हैं और शुगर्स को भी कट करके रखना है डाइट के अंदर. इनमें जब इन्फ्लेमेशन की बात कर रही हूँ, there lot of studies are going on and done that there's been this one term called as Mediterranean diet, which is very important, very nice diet whenever the inflammation or the chronic inflammation is considered, and especially in the PCOS women. And what exactly is Mediterranean diet is that it is rich in fibers because इस diet के अंदर you eat more of whole grains, you eat more of vegetables, you eat more of fruits, and fats में आप लेते हो healthy fats, that's like more of omega-3 fatty acids, and the proteins are good quality, moderate amount of proteins but high biological proteins. So ये perfect diet हो गई जब अपन इतनी देर से बात कर रहे हैं PCOS की. So this is a perfect example that you consume a Mediterranean diet. So it will consume. And Mediterranean diets में moreover fish and fish oils को use किया जाता है. But in Indian context, if I say, you can always use flax seeds, or you can always use omega-3 fatty acids के sources, especially flax seeds, because that's richest source of omega-3 fatty acids as far as the vegetarian option is concerned. So आप Mediterranean diet is a better option. Whole grains and whole wheat. Whole grains में आपको again fiber बहुत अच्छा मिलता है, and you get micronutrients which are very important like your zinc and selenium, which you miss out on when you're not taking, and it is increasing your complex carbohydrates. And then after pulses again, which is for your proteins, and high amount of fruits and vegetables are again increasing your fiber in the diet. So Mediterranean diet is perfect example if we consume for a PCOS and to reduce inflammation in our diet. And one more point which is very important is please do not undereat. अपन इतनी देर से बात कर रहे हैं ओवर ईटिंग की, एक्सेस ऑफ ईटिंग की, वेट कंट्रोल करने की, और क्योंकि हमारी आदत हो जाती है इस चीज को दिमाग में रखने की कि मुझे वेट कंट्रोल करना है, मुझे मैनेज करना है, तो होता क्या है उसकी वजह से अंडर ईटिंग इज अ वेरी कॉमन प्रॉब्लम. इतना नीचे चले जाते हैं हम कैलोरीज में दैट वी डोंट इवन टेंड टू ईट दैट मच व्हिच इज एक्चुअली रिक्वायर्ड बाय आवर बॉडी. सिंपल बॉडीली कोर्स करने के लिए जो इंपॉर्टेंट कैलोरीज या एनर्जी हमें चाहिए वो भी नहीं मिलती. तो प्लीज अवॉइड अंडर ईटिंग ऑल्सो, क्योंकि जहां अंडर ईटिंग की बात आई है या टू मच ऑफ कैलोरी रेस्ट्रिक्शन की बात आई है, तो क्या होता है हम एक्सेस में जहां अंडर ईटिंग करते हैं दैट स्लोज डाउन आवर मेटाबॉलिज्म आल्सो. आपका मेटाबॉलिज्म को अच्छा रखने के लिए इट इज वेरी इंपॉर्टेंट टू कीप ईटिंग समथिंग और एल्स इन स्मॉल ड्यूरेशन ऑफ टाइम, एंड दैट ईटिंग पैटर्न शुड बी ऑब्वियसली लो इन कैलोरीज, moderate in carbohydrates, low in fat, but that fat should be healthy fat, so that some amount of calories are going continuously and you are not under eating yourself or under nourishing yourself anytime. One more point which is also very important is to get enough sleep. बहुत जरूरी है, क्योंकि हम बात कर रहे हैं हमारा वेट के लिए, हम बात कर रहे हैं हमारा लाइफस्टाइल मैनेजमेंट के लिए. PCOS is nothing more than a lifestyle management. आप जब भी आप PCOS की बात करोगे थोड़ा तो आपका मेडिकेशन आ जाता है, और जब तक मेडिकेशन चालू नहीं होता डॉक्टर भी यही बोलता है कि जाके अपना वेट कंट्रोल करो एंड थिंग्स वुड बी इन कंट्रोल. आई एम श्योर Dr. Shikha will agree to it that every PCOS patient doesn't need a medication. There are many patients who can control their PCOS just by controlling on their lifestyle, just by maintaining on their lifestyle, which includes your sleep, which includes your diet, and which includes your exercise. So sleep is a very important point as far as the lifestyle management is concerned. You have to have enough amount of sleep. Enough amount of sleep is very important. Why? Again, because if you don't have enough amount of your sleep, तो बड़ी कॉमन चीज जो देखी गई है PCOS में, एक तो डे टाइम स्लीपिंग बढ़ जाती है. बहुत कॉमन है, लोगों को बैठे बैठे नींद आने लग जाती है. आप चाहते हो नहीं चाहते हो लेकिन आप बैठे बैठे सो रहे होते हो. डे टाइम स्लीपिंग इसलिए बढ़ जाती है बिकॉज रात में आप ढंग से सोए नहीं होते हो. स्लीप एपनिया इज वेरी कॉमन. एपनिया तब होता है जब आपका बहुत ज्यादा वेट बढ़ जाता है. दैट्स टू मच ऑफ ओबेसिटी कम्स इन, एंड एपनिया इज अ वेरी एपनिया मतलब नॉट जस्ट स्नोरिंग तो एक छोटी सी चीज है, स्नोरिंग के भी पापा हो गए एपनिया. That's basically in a layman term कि आपका बैठे बैठे भी आप सो रहे हो तो there's suddenly a lot of sound which comes in, snoring जैसा sound आता है, and that's basically sleep apnea. That's obstruction of airway, and that's very dangerous. It can be very fatal and life threatening also. So sleep apnea and insomnia is again a big problem. रात को नींद नहीं आती है ढंग से, नींद नहीं आती है उसकी वजह से sleeplessness होती है या डे टाइम स्लीपिंग होती है. अगेन हमारा जब नींद अच्छे से नहीं आती है तो अगेन हमारा हार्मोन इन्वॉल्वमेंट चालू हो जाता है. इसके अंदर भी फिर से हमारा ग्रेलिन और कॉर्टिसोल, दो हार्मोन्स को मैं डिस्कस कर चुकी हूँ, फिर से आपको एम्फसाइज करूंगी. इफ यू हैव अ पुअर स्लीप पैटर्न यू विल हैव मोर ऑफ ग्रेलिन हार्मोन्स, यू हैव मोर ऑफ कॉर्टिसोल हार्मोन्स इन योर बॉडी, व्हिच अगेन विल इंक्रीज योर हंगर लेवल्स. आप ज्यादा खाओगे यू आर मोर प्रोन टू गेन वेट. ज्यादा वेट गेन करोगे अगेन आपका PCOS लेवल्स जो है वो मैनेज नहीं हो पाएगा. सो इट्स अ विशियस सर्कल, चलता रहता है. unless that you don't cut that circle, have enough amount of sleep, good amount of sleep. So a good amount of sleep is 6 to 7 hours of sleep, 6 to 7 hours of adequate sleep between 10 to 6 in the hours, 10 PM to 6 AM. इस बीच में 6 से 7 घंटे, ये नहीं कि रात में थोड़ा सा सो लियो, दिन में खूब नींद निकाल ली मैंने कि मैंने मेरा 6-7 घंटे का कोटा पूरा कर लिया. That's not right. That then you're disturbing your circadian rhythm, which is again wrong. ठीक है. So you have to have a good amount of sleep. And last but not the least, you have to manage your stress. That's so important. आपको stress levels manage करना. Dr. Manisha has already explained how to manage your stress levels because stress is so important. मैं ये नहीं बता रही आप stress manage कैसे करो because that's not my job. My job is to tell you कि how stress can be so difficult for your body. फिर से PCOS के लिए when you're concerned, stress levels जो है again आपके cortisol hormones को aggravate करेंगे, because that's आपका जो basically involvement होता है ना, वो इधर इन hormones के आसपास में घूमता रहता है, तो आपका cortisol बढ़ेगा, cortisol बढ़ता है, insulin resistance आपकी poor हो जाती है, insulin resistance poor हो जाती है, sugar imbalance होता है, sugar imbalance होता है, साथ साथ में weight का भी imbalance हो जाता है. So there's so many things happening all together again, if by one thing that we are increasing too much of stress in our body. Too much of stress will also increase your inflammation, क्योंकि chronic stress रहता है, that again increases our inflammation in the body. Inflammation बढ़ता है तो again उसके साथ में अलग अपने problems आगे मैं आपको पहले discuss कर सकती हूँ. तो ये सब आपस में जुड़े हुए हैं. Again, it's a vicious circle. You need to cut that. Unless you're not cutting that, this is not going to help. तो आप इसको स्ट्रेस को कैसे भी दूर करो. अब psychological management, Dr. Manisha has discussed, and also very important thing is your physical activity. That's like biggest stress buster, I think. Physical activity बहुत important इसलिए भी है क्योंकि हमें weight manage करना है, हमारा insulin, हमारा blood sugars को हमें manage करना है. So very important to have good amount of physical activity. That is like at least 1 hour of vigorous exercise. That can be any kind of exercise, whatever you like to have. It can be your it can be a regular walk, brisk walk. It can be your cycling. It can be your swimming. It can be your yoga, Zumba, aerobics, XYZ, whatever kind of physical activity you want. वो आपको डेली का 1 घंटा देना ही है for at least 5 days in a week. Minimum is 5 days. रोज करो तो nothing like it, but minimum is 5 days. And also try to do some kind of breathing exercises which will help you in relieving stress, like your pranayams and your Brahmaris. Also yoga. Yoga is like a multifaceted thing. Surya Namaskar aap karte to you will have everything in one thing in itself. So that will help you in reducing your stress levels. That will help you in maintaining your blood sugars, maintaining your weight, increasing your metabolism, because that's so important to increase your metabolism as far as the PCOS is concerned. जितना अच्छा metabolism रहेगा आपका body का, उतना better आपका weight maintenance रहेगा. तो इन सब चीजों को अपने को consider करना है to have a good and healthy lifestyle as far as PCOS is concerned. I think I have spoken enough, and over to you, Shilpa.
Thank you so much, Medhavi. Again, the session has been so fruitful and informative by Dr. Shikha Gupta, whatever information she gave us, with Dr. Manisha Gaur on the stress levels and the hormonal imbalances and the anxiety that today's children, especially, they tend to take it up. And then finally by you that how these 3 things are interrelated with your diet pattern and your lifestyle is so important in today's life. I mean, even for myself, I was taking tips. So quickly, there was a question that eating basil seeds, does it help as a good fiber?
Yeah, of course. Basil seeds have good fiber. In fact, I should say all the seeds have good amount of fiber, because seeds are basically having an insoluble fiber. There's like 2 kinds of fiber. One is soluble and one is insoluble. So these are all insoluble fibers, which actually increases the fiber load in our body, and also helps in maintaining the sugar levels and the weight management. So in case all the seeds, may it be basil seeds, may it be your flax seeds, may it be your chia seeds, may it be your sunflower seeds, safflower seeds, or your watermelon seeds, your anything, kharbuja, or anything. I mean, all the seeds, melon seeds, muskmelon seeds, all of them are good. So you should, they should, in PCOS particularly, you should increase a good amount of seeds in your diet. So it's like handful aap le lo. It can be mix of all seeds, or it can be any one seed. I would suggest it should be a mix of all seeds. Just take handful of them and just have it with water. So it will surely help you in increasing the fiber content, and also it will help in maintaining your PCOS levels.
Right. So great. Nowadays we are getting these mixtures also readily available in the market. So these seed mixtures so can be consumed in a healthy manner. So another child that asked that can we do skipping during our periods?
Yeah, of course. Because it is absolutely normal to do any kind of physical activity during your menstrual cycles also. It is absolutely on your capacity and your body's, how your body can manage it. But there's no kind of restriction for any kind of exercises, even when you are with your cycles. If your body is allowing you, you can do it. And if you just want to, like I said, you need to exercise at least 5 days in a week. And say if you're even skipping a day or 2 when you're with your cycles and it's unbearable for you to do any kind of exercises, then absolutely you can skip those days. But if it's bearable and if you can do it, there's no exercise which is you are supposed to stop even during your cycles.
Right. So of course there are lots of other questions, but because of time constraints, we'll have to, shut it down for today. Sign off. Once again, very, very, very thankful to you, Dr. Medhavi, to Dr. Shikha and Dr. Manisha Gaur to be here on board with us on this very sensitive topic of PCOD. And I'm sure lots of students and everybody has gained knowledge on this. Of course, our this video will be available on our YouTube channel, which is in the name of YEAH exclamation mark, and on our Facebook also. So if anybody has missed out on it, they can definitely go and attend to it once again and see through it. With this, we sign off, thanking all the attendees, principals, teachers, students, parents, and our three lovely guests here. And of course, Pankaj, thank you so very much for all the technicalities and helping out with that. Signing off today. Have a lovely day, evening, and happy days ahead. Bye-bye.
Thank you so much. Bye-bye.